This back-to-school season, many parents are still hesitant about getting their kids vaccinated against preventable illnesses. Joining me now to discuss is Kate Guzman, registered nurse and public health administrator for Oakland County's Health Division. Thank you for being here today.
Thank you for having me.
So when we're talking about these vaccines, we're not only talking about flu and COVID, but vaccines for many illnesses that had kind of been eradicated for a long time. Now we're seeing outbreaks. What concerns you the most when you see these vaccine numbers going down?
Well, I really worry about the vaccine preventable diseases that could impact the whole community as our community immunity drops. We call it herd immunity or community immunity. But we're seeing diseases like measles, for example, which may not really impact a healthy child. But when you have a child that's immune compromised and they get measles, then I really worry about severe health outcomes. Or diphtheria, for example, pertussis. We're seeing these vaccine preventable diseases crop up in lots of communities across the nation, and it is due to our lowered vaccine rates.
Yeah, what would you say to parents, families who assume that that herd immunity is going to be there, that if they're a little uneasy about it, they don't need to get their child vaccinated because most everyone else already is?
Yeah, please don't make assumptions that we have herd immunity. In the past 10 years across the state of Michigan, the vaccine rates for toddlers, the 19 to 35-month-old age range, have dropped by 10 percentage points. Wow. Where previously in 2013, there were 76% of that age group fully vaccinated. Now we're looking at 66%. And so those rates are dropping, and so you can't assume that you're covered by all the kids in the classroom are already being vaccinated.
Yeah, and this has really been a hot topic, kind of a controversy, especially since the pandemic.
Absolutely.
A lot of misinformation out there, whether people are buying into that or they're just kind of nervous and uneasy because they've heard so much of it. What do you say to those parents who do feel a little uncomfortable and aren't sure what to trust?
I am so glad you're bringing this up, because looking for the right source of information is vital when you're a parent. The information that's out on social media, it looks so good. It looks reputable, it looks respectable, looks like it's from, a worthwhile source, but you have to be very cautious. You have to look at your references, look for the CDC, look for those .gov websites, look for academic websites, like the University of Michigan, Mayo Clinic, CHOP, the Children's Hospital of Philadelphia. Those type of sites are fact-based, and you can find the right information so that you make the right decisions for your family. But also finding a provider that will work with you, that will answer your questions, and vaccinate your child at your schedule. So it's a really outdated mindset that we used to have in public health, where you have to follow the strict schedule that the CDC sets out. When your child is this age, they get these vaccines. When they're this age, they get these vaccines. Now, that is the tried and true tested schedule. We still stand by it. But as a parent, if you're concerned that your child is getting too many vaccines at once and you want to space them out, find a provider that encourages that and supports that. Because if you want to give your child one vaccine at a time and at the end of 12 months they're fully vaccinated, that is fantastic, and I support that.
Okay, and if we can address it head on, I mean, is there any legitimate evidence that any vaccines cause any kind of autism spectrum disorder, as that is typically one of the big concerns?
It is one of the big concerns, and I have been a public health nurse for a long time, and it has been one of the concerns since I started in 2006. It shocks me that we haven't been able to dispel that myth.
Yeah.
So no, there are absolutely no studies, and the false studies that were claimed to be true back then absolutely have been disproven, specifically about autism.
Yeah. How about adults? So with kids, it's a little bit easier. You're seeing the pediatrician. They're letting you know this needs to happen. It's easy to kind of lose sight of what vaccines you're up to date on when you're not a child anymore. So what would you recommend for adults who haven't been vaccinated for anything in a long time?
Yeah, well, I mean, head to your provider. But actually find a medical home first.
Yeah.
Because I do find lots of adults don't even have a medical home. They don't have a primary care provider that they trust, that they're building that relationship with. So find a medical home, build that relationship, and have vaccines be part of that conversation. Just in terms of preventive health measures, and like colorectal cancer screening, mammograms, these are all really important. And if you're only seeking health care when you're sick, only going to an urgent care, you won't hear these types of messages from your provider.
Yeah.
So finding a medical home, make it a point to go for your annual physical. I know no one wants to get their cholesterol checked and their weight and hear those types of messages, but they're really important. And as an adult, there's lots of vaccines that we need.
All right. Are you hopeful that these numbers might start to turn around, especially when it comes to school-age children, the farther we get away from the pandemic?
Absolutely. I'm really hoping that we're building that trust back up in public health, especially with this change in mindset where we're trying to meet families where they're at. And so kind of shifting from this is what the experts say to do and we're telling you to do this, but shifting from that to what feels good to you as a family? What questions do you have? How can I help you move your child along this vaccine schedule at a rate that you feel comfortable with?
All right. Well, thank you so much for joining us. This is Kate Guzman, Oakland County Health Division. Thanks so much for being here.
Thank you.
Appreciate it.